My name is Megan Lambeth. I'm in Communications 231, Section 2, and this evening I'm going to be conducting an informative speech. First off, let me show you my room set up where the speech is going to be held. We are in my living room this evening. Here's my cameraman's sidekick and the cameraman. So this informative speech is going to be about patient advocacy. So we all have loved ones that we care about deeply. And if you're like me, you want your loved ones to receive the most adequate care humanly possible. But as my job as a CNA and an EMT, I have come across many instances where those patients don't always have the ability to gain the kind of care that they need, let alone the kind of care that they want. So this speech is to help inform you guys on how to be a patient advocate for the elderly community and to help them get the amount of care that they need. So the first thing that we need to figure out is what type of care do these patients usually need? Whether it be everyday care, like walking your dog, going and getting groceries, doing daily laundry, helping clean up the house, or sometimes even just being there to listen to their stories. Some other patients might need advanced care. Some of the advanced care can be as far as keeping a patient logbook, where you chart their vital signs, keep up with their medication administrations, make sure that their prescriptions are being filled in a timely manner so they don't run out, as well as keeping up with their doctor's appointments. One thing that we run into with the elderly community is that they are very independent and prideful individuals. They don't always know how to ask us for help because they don't want to have to ask for help. But that is where, as a patient advocate, we step in to help them receive the care that they so desperately need. So who can provide this care for these patients? That can be anyone as far as a family member, a private home health aide through some private home care agencies, as well as skilled nursing facilities, assisted living, or even independent living facilities. As you see here, I am wearing my scrubs. This is my uniform that I wear to my job as a CNA. I do work in the hospital. This allows me to be that patient advocate and help my patients get the best care that they need. You might see a CNA working in inpatient settings, in their homes, or even in a nursing facility. So to determine the amount of care that a patient is going to need, it's going to be based off of the patient's ability to provide for themselves. Are they alert to who they are, where they are, when they were born, how old they are, what day it is? Do they know when to take their medications or how to care for themselves? Are they going to remember to turn off the stove if they start cooking something for dinner, or is it going to be a health hazard? So if they are able to make some of these decisions for themselves, family or patient advocates can step in and speak with a healthcare professional. This is when they can decide if private home care is going to be best for the patient, or if they're going to need to go to a skilled, assisted, or independent living facility. The facilities do give the patients a chance to grow into it. They can start out as an independent living, where they can still do some of their daily tasks by themselves. And then as they advance, they could get into the assisted living facilities, where you have nursing professionals or CNAs like myself on site, helping patients do the daily tasks that they might not be able to do for themselves anymore. But do these patients receive adequate care? That is one thing as a patient advocate that we have to watch. What does their quality of care look like? Are they happy in their facility where they're at? Do they get the care that they need? Are they getting the attention that they need? As you see over here on my chart, this is one thing that doesn't get a lot of light shined on it. It kind of goes unnoticed, and that's nursing home abuse. It can be as far as physical abuse, emotional, mental, or even just between residents. They could be very catty, like they don't like one another. or they could just be hostile and just mean. But that's whenever it's our job to see if the facility is a good fit for these patients. Are they happy? Is this facility gonna make them go downhill? Sometimes you'll notice that they stop eating, they're lonely, they become depressed, and that makes their quality of life plummet. It goes downhill very quickly. How are their daily lives affected? Are we helping them, or are we just making it worse? So as a patient advocate, it is our job to ensure this quality of care. When our patients don't have the voice to speak up for themselves, it is our job to speak up for them. If they can't stand up for themselves, we stand up for them. If we see that they're unhappy or their quality of care is not what we expect, then that is when it's our job to step in and make it better. One thing to always remember, and I hope that you learned from this speech, is that when you have a patient that needs care or an elderly patient that can't decide what to do next, be their voice and treat them like your loved ones. What would you like your loved one to feel? What kind of care would you like for them to receive? And as long as you go on treating your patients like they're your family members, then the quality of care will always be there. Thank you.